Hello everyone! Today we will learn about Parkinson's disease, a progressive disorder affecting movement and coordination. Let's make nursing learning easy and fun so you can remember everything for exams and clinical practice. 1. Definition. Parkinson's disease is a progressive neurodegenerative disorder of the central nervous system that primarily affects movement. It occurs due to loss of dopamine-producing neurons in the substantia nigra of the brain. Mnemonic to remember. Parkinson's equals problems with Parkinsonian movement. 2. Causes, risk factors. Primary idiopathic Parkinson's, most common, exact cause unknown. Secondary Parkinsonism, caused by drugs, toxins, or brain injuries. Risk factors. Age, usually greater than 60 years. Genetics, family history. Exposure to pesticides or chemicals. Mnemonic, age. Age. Genetics. Environment, toxins. 3. Pathophysiology. Dopamine deficiency. Dopamine is essential for smooth, coordinated movement. Degeneration of substantia nigra neurons leads to imbalance between dopamine and acetylcholine, causing motor symptoms. Result: tremors, rigidity, bradykinesia, slow movement, and postural instability. Visual tip: show diagram of brain highlighting substantia nigra and basal ganglia for clarity. Signs and symptoms. Motor symptoms, trap mnemonic. Tremor, usually at rest, pill-rolling fingers. Rigidity, stiff muscles. Akinesia or bradykinesia, slow movement. Postural instability, balance problems. Non-motor symptoms. Depression, anxiety. Sleep disturbances. Constipation, bladder issues. Cognitive impairment. Tip: use animations to demonstrate tremor, rigidity, and slow movement. 5. Medical treatment. Goal: restore dopamine balance and improve quality of life. Medications. Levodopa plus carbidopa, mainstay for motor symptoms. Dopamine agonists, pramipexole, ropinirole. Now B inhibitors, selegiline, rasagiline. COMT inhibitors enhance levodopa effect. Surgical treatment. Deep brain stimulation, DBS, in selected cases. Supportive therapy. Physical, occupational, and speech therapy. 6. Nursing management. 1. Assessment. Monitor motor symptoms, tremor, rigidity, bradykinesia. Assess gait, balance, and daily activity performance. Observe psychological well-being. 2. Nursing interventions. Provide safety precautions. Prevent falls. Encourage small, frequent meals to prevent choking. Assist with mobility and exercises to maintain independence. Promote medication adherence and timing. Support emotional and psychological needs. 3. Education for patient and family. Teach disease progression and symptom management. Importance of physical activity and balanced diet. Caregiver support and counseling. Mnemonic for nursing care. Move safe. Monitor symptoms. Organize routine and exercise. Verify medication adherence. Encourage independence. Safety first. Assist with ADLs. Family education. Emotion support. 70. Summary conclusion. Parkinson's disease is a chronic condition, but with proper nursing care, medication management, and support, patients can maintain independence and quality of life. Remember, trap for symptoms and move safe for nursing care. Call to action. If this video helped you, don't forget to like, share, and subscribe for more nursing content made easy.